Today, SIH hospitals join other hospitals and healthcare facilities literally across the country in sending letters to patients that were treated with recalled drugs from the New England Compounding Center. The latest recall does not include the original injectable steroid that is linked directly to the recent outbreak of fungal meningitis. However, this latest series of drugs and/or solutions happen to be produced at the same facility. The FDA and the Illinois Department of Public Health, out of an abundance of caution, has asked A, that hospitals pull these drugs, which we have done, and B, to send letters to any patients that were treated with or came into contact with these drugs. No confirmed reports of infections definitively linked to this second set of drugs or solutions. I'm referring to this as recall number 2, since recall number 1 was specifically the injectable steroid linked to the original fungal meningitis outbreak. The FDA and IDPH are working with us hand in hand, as is the Illinois Hospital Association. Federal investigators are questioning the sterility of these drugs that were produced at the New England Compounding Center from May 21st through about October 5th. You'll see copies of a couple of the letters that we're sending out to patients today. One says October 4th, the other one may say October 5th. They vary by about a day, but in general, it's about a 5-month period that stretches from May 21st through about October the 5th. These medications fall into 3 particular classes. One is an injectable product that was produced at this compounding center. The other is an ophthalmic drug that is used in conjunction with eye surgeries. And the third is something called a cardioplegic solution. Cardioplegic solution is used to control cardiac muscle activity during open heart surgery to prevent injury to the heart and certain other cardiac procedures. So we're dealing with those 3 specific kinds of drugs. Another set of injectables, the cardioplegic solution, and the ophthalmic solution. As a result, SIH identified 26 patients that were treated with the cardioplegic solution at Memorial Hospital of Carbondale, and 1 patient treated with the ophthalmic solution. In addition, we are mailing letters to approximately 5,000 other patients who received injections produced by the NECC. Now, these injections, again, aren't to be confused with the original tainted injection. They just have the sad misfortune of being produced at the same facility. Those 5,000 or so patients receive these injections either at Memorial Hospital of Carbondale or at Herrin Hospital. At present, it does not appear from any of our records that St. Joseph Memorial Hospital in Murfreesboro utilized any of these drugs that are involved with recall number 2. And again, this subset of medications not directly linked to any outbreak at this time. We have a few individuals for you to talk to this afternoon. Dr. Kaufman is a specialist with infectious disease, and after Dr. Kaufman talks and answers your questions, John Chaney will take the podium. John is a longtime SIH employee and the manager of pharmacy at Herrin Hospital.
Okay, well, I'm not sure what everyone has information you have about the meningitis outbreak. Being an infectious disease doctor, that will be my focus on the actual infections that have been identified so far. There have been 47 cases, none from this hospital, that involved fungal meningitis. Those 45 of them were a fungus called Exarahilum, which is ubiquitous in nature and soil and rarely causes human disease. 1 case of Aspergillus meningitis, which is another ubiquitous fungus, and last one called Cladosporium. So those are the funguses that have been associated with the meningitis. There have been 1 potential case in an open heart surgery that used the cardioplegic solution that was found to have Aspergillus. That was a cardiac transplant, which is, as you can imagine, quite different than an open heart surgery. It also involves a lot of immunosuppressant medications afterward, And so while they have not found a direct link between the cardioplegic solution and a fungal infection, there was this one patient, and so because of that, it has, as Roz said, increased the surveillance and the interest in these other solutions to make sure that there was no contamination of any other medications. I guess at this point I'll open it for questions if anyone has particular things that they'd like to know about the infections.
Did that particular transplant patient have any follow-up check or anything like that that involved talking about this? Or?
That patient is not my patient, and so I can't expressly answer that question. I do know that I was at an infectious disease conference last week where the CDC did come and speak, and that investigation is ongoing. Because aspergillus is a common fungus that we see in immunocompromised patients, it sort of threw up a red flag, but they have not found aspergillus in any of the original methylprednisolone solutions or in any of the cardioplegic solutions thus far.
And you work with these medicine, drug solutions, whatever. What's the right wording we should throw with that?
I actually don't work with them. I work more with the funguses and bacteria and viruses that result, I guess. It's a difficult question to answer because there are steroid injections, and most people are very familiar with that. Cardioplegic solutions is a phrase that most people have not heard of until this investigation. And then the ophthalmic drops, most people would understand eye drops. Some of the medications I think that Roz is talking about are other quote-unquote injectable medications. They cover a wide variety of different classes, and I'll let the pharmacist explain a little bit more about the particulars.
Memorial Hospital, obviously a cardiac center for this area. People have artwork done in Southern Illinois, it's done here. So if someone gets a letter, they're going to be obviously alarmed about this. As a physician, what do you tell them? And I know it's detailed in the letter, but just coming from you, what things do you tell them to ease their mind? I mean, you don't want to worry people, but at the same time, there is a real concern.
Oh, absolutely, and I think you hit the nail on the head. You want people to be have a high level of vigilance, but you don't want people to sort of become worried with every itch or scratch or redness that they might see. The biggest thing from my standpoint as an infectious disease doctor is to explain to them the signs and symptoms of infection and things that they should watch for. Obviously, meningitis is something that most people understand. Fevers, stiff neck, light sensitivity, or what's called photophobia, where light is very irritating to the eyes. Those are the main symptoms of meningitis. Some of the steroids have been used in joint injections, so if the knee that was injected becomes red, swollen, painful, again, fevers, those are symptoms to watch for. With the cardioplegic solution in particular, that involves open heart surgery, so you have a sternal incision that needs to be monitored, as it does with any cardiac surgery. So you're looking for irritation, redness, and sort of a drainage that can come from the old incision. Fevers, shortness of breath, chest tightness, those would be the symptoms to watch for in patients that have had the heart surgery.
As an infectious disease specialist, I mean, have you been following this case? What makes this case particularly interesting to you?
Well, it's any time that you can link an infectious disease to a cause, it makes it very interesting because more often than not, infectious diseases are very random. What you come in contact with, what you ate, where you went on vacation. So that sort of detective work on my part is fun and interesting, and that is what I think keeps it exciting. In a case like this, it becomes less about the detective work to find out what happened as it is the very tedious work of tracking patients, tracking lot numbers, going through each individual medication and trying to figure out. It's very interesting from a sort of epidemiologic standpoint to find out how did this happen, where was the contamination originally, and how did that spread. So that gets more to sort of the CDC investigation of the drug and less about the nuances of patient's history.
Is there any sort of timeline set about how long it takes if someone has been infected for symptoms to manifest?
Yes,
when specifically can someone reasonably think, okay, I'm in the clear?
Right. Well, they estimate that it takes between 1 to 4 weeks for people to show symptoms, and that's actually why they sort of put that May date in effect, that initial May 21st date. Anybody that had gotten anything prior would have been sick by now. And so now we're dealing with people who could have gotten injections all the way up until September, October that we need to watch for the next 1 to 4 weeks. The CDC is very cautious about putting a hard stop date on it, though, because obviously everybody's body is different, and the amount of, let's say, infectious agent that you were exposed to is different. So if you got a little bit of fungus in your injection versus a lot of fungus in your injection, that could determine how quickly you show symptoms. But generally speaking, 1 to 4 weeks afterward is when we have the highest vigilance, and then every day or week after that, we get more and more reassured.
You know, we said injectables. Could you kind of break that down? I mean, someone at home hears injectables. I mean, if I cut my hand open and have to come here and get stitches, am I going to get an injectable from one of these facilities?
Great question. I'm going to defer to the pharmacist to answer that question.
We haven't heard much about the actual origin of this fungus. I've heard mentions of it coming from a leaf. I mean, would you have any idea as to where this would have originated, or?
No, it's sort of everywhere, and that's the tricky part about figuring out how it got there. Not familiar with pharmacy practices in general. I'll let him speak of that. But we always get concerned whenever we're in surgery or doing a procedure or making medications that they are done in a sterile or semi-sterile environment. And so how things get in is difficult to know. A lot of times they are in soil, leaves, water supply even. And so things that you take for granted that are going to be safe are sometimes not.
This might be a question for the pharmacist too, but I'll ask you anyway. The NECC, how well known, how prominent, how respectable is this organization from you guys buy products from them, I had a laundry list of hospitals and companies that bought from them. Is this a well-known company? Is this respected? Where does it, from a doctor perspective, stand?
I'll defer to him about the...
All right, step
Go
up
ahead,
there.
John, take the podium. Thank you, Dr. Kaufman.
Well, it looks like it's my turn to answer some of the questions, so if you repeat that question.
Sure. The NECC, I'm curious, the document that I was looking at, and I know it's inaccurate right now, from the FDA, of how many hospitals, companies, third parties buy from them. I'm curious from your standpoint, how prominent, how respectable, how credible is this place?
Well, 2 years ago, no one heard of this company. And basically, it's an outspring of the drug shortages that we've been talking about for the last, 3 or 4 years, and how big a problem that's become. So there's been opportunities for companies to start up, to produce, repackage some of these products. The ownership is also owned by a company called Ameridose. Ameridose we've bought product from before, but when you're in a purchasing situation as a pharmacist, my job is to get the medications that Dr. Kaufman or any Kaufman needs to use to treat their patients. It's also my job to ensure that what we're getting is a safe and product that meets the standards. What we rely on, and in this instance, this company was in Massachusetts, in the Boston area, that they have a license to produce product in that state. They also have an Illinois license to be able to sell their product in the state of Illinois. So, where our leap of faith is that the state agencies are doing their job, they're meeting their license requirements, they're doing their field test, all that sort of stuff. Being a compounding center, they aren't quite at the same rigid standards that a manufacturer would be, that the FDA would hold them accountable to. So, to say how well known is this company, probably, I can ask everybody in this room, and probably no one's heard of them before this but me. And because we did buy some product from them, but it was always last opportunity to buy something that was very scarce, but we needed it to treat our patients.
What has the hospital done at this point with all the suspect compounds?
Well, the first day that I heard of it, I don't remember what day it was, but my cell phone went crazy, and I was out of the hospital at the time, and we were talking about the methylprednisolone and what was showing up there. So the first question is, do we have any of that? in Herrin Hospital or in SIH in general. And a very quick check of purchasing records and that sort of stuff showed that we never purchased any of that product. So, you know, you got that, you know, sigh of relief that we've made it past that. And then as the story grew, you know, we were then looking at other products that this company made. And at that time, we not only searched our purchasing records of that product, but anything and everything that we had purchased from NECC from that May 12th date to the present time. And then we took all that off our shelves. We checked floor stock throughout the hospitals to make sure that we didn't have any, you know, in the med room, you know, that could be used for treated patients. So we pulled all of that, quarantined it, set it aside, and waited to see what the FDA, CDC, what recommendations were to follow. So we had all that product then, you know, put aside. Then the next step for us to do was to say, okay, let's identify from that May 12th date, how much product did we buy and how much did we have here on this quarantine to see what that difference was. So that kind of gave us an idea of what potentially was given to one of our patients. So the next step then was to go through our records and our charts and our billing records in a quite tedious process to identify every patient that may have come in contact with any of these products, and these products were initially voluntarily removed, and then the FDA said to take all their product. But there's never been any case related back to these other injectables that we had. So, you know, luckily and hopefully we don't hear any stories about other products being involved, but we didn't want that product out. We pulled all that back and have sent it back.
In your experience as a pharmacist, would you say it's rare for a compounding pharmacy to actually sell medications in that mass?
You know, it just grew out of the need of that drug shortage situation. It's pretty rare. We do have compounding pharmacies even in the area that make special topical creams and suppositories and kind of some oddball things that most community pharmacies and hospital pharmacies wouldn't make on their own. And so as these people are, you know, local pharmacists are making that, then, you know, you do see some of that. It's very limited. It's very rare. Most of the stuff we use in the hospital are reasonably common products, and, you know, we have a good supply chain of how that comes through. But then once again, that drug shortage issue kind of just really creates some challenges for us.
I'll ask again what I asked for. When we say injectables,
Yes.
you know, just kind of describe for me, what is an injectable? I mean, what would you consider?
Well, an injectable can be a lot of things. It could be anywhere from an IV infusion, where a medication is added to an IV solution and infused over a period of time. It could be a direct IV push, where it goes right into the vein over a short period of time. It could be an intramuscular, it could be IM that goes into the muscle. It could be sub-Q, and there's some, you know, a few other, you know, minor routes that an injection can go. But so, you know, that's what we looked at. Anything that was injectable, whether it be IM or IV, or things that products that we pulled off the market or pulled off our shelves rather.
What's the frequency of those being
Oh
used?
gosh.
It's pretty
It's pretty frequent.
Yeah.
I mean, if you have a patient that comes into the ER and they've got nausea and some pain, there's probably going to get 2 injections right there, probably an analgesic and then an anti-nauseous medication. And they work quicker, you know, they take care of the patient quicker. If you're nauseous, you probably can't take anything PO because it come right back out. So the injection is the best and, you know, probably the most prevalent way to give a lot more medication.
Is that concerning that injectables are part of this? I mean, it's so big.
It doesn't matter if it's injectable or PO. It's very concerning to me when this happens. You know, you think about someone that makes a product, and it could be a manufacturer that we all know. We take that in good faith, and when that product comes to us, it's sterile. It's going to meet up its dosage standards. You know, USP and FDA, all the rules and regulations are met, and that the product that we delivered into the patient is exactly what's expected when the doctor writes that order. So they can see how they respond to that medication and to that strength and dose of that medication to see if it's working, how well it's working, what adjustments need to be made. So you have a lot of faith in the industry that what you're getting, you know, shipped into you is exactly what you ordered, and it's going to work exactly as it's intended to be. So when you get even a little crack in the dam like that, you worry about it, and then you check the entire dam then to see if there's any other places that there might be an issue. So we really try to stay with major manufacturers. We try to stay away from any of the secondary wholesalers that provide product, but once again, we get back to the drug shortage. When something's absolutely necessary, sometimes they're life-saving medications, and if that's the only place we get it, then we do our due diligence, we try to check the company out, we check licensures to make sure that's okay. We look to see if they've had any of their product reported with any problems. We take all the steps that we can, to ensure that it's a quality product.
From the standpoint of, now correct me if I'm wrong, like the eye drops, what was causing meningitis was the steroid portion of the eye drops. Like, correct me if I'm wrong.
I can't speak to that. I don't know for sure. Okay. I think they're still looking at causes of where some of this causes would be great, and when we find out more specific what some of those causes are, if I don't know if methylprednisolone was in that eye drop formulation, I haven't seen that exactly. It's kind of a leap to say, yeah, it's that component of it. It could be dealing maybe more with the person that made it. There's environmental, concerns that sometimes you look at, and that's one of the things they're looking at with this compounding center. Is this an environmental cause? I tend not to think that because it's pretty much been one product, so I think it's the product. But still, if you start seeing other things creeping in, then you got to think, in other directions.
And I know this was done as a precaution at the hospital here in particular, just to take everything off the shelves that was made by this company.
Yes.
Is that something that's common? If this has ever happened before?
That would, not to this extent, but we'll get a drug recall, or we'll get something, and it's immediate. We get some first notice, we pull it off the shelf. We try to go through our steps to determine how long do we have the product. Have we sent it to other facilities? Something maybe we bought in Herrin and we loaned it to Memorial or something like that. We try to really talk to each other back and forth to see, if we have any of that product, but we act as quickly as possible.
Have you ever taken it to the standpoint of removing an entire, everything that was made by one company at one facility? Has it ever been taken that far?
The Tylenol scare that we had a few years ago, that pretty much wiped out the entire Tylenol line of product that J&J made. So yeah, we've gone through that before. You talk about a huge inconvenience for the consumer. I've had people that have had Tylenol in their lives, and now all of a sudden there's none available, and now we're thinking of other alternatives. So we've been through things like this. We didn't see the meningitis like we're seeing with this drug, but yeah, occasionally, I like to say it only happens once or twice in my lifetime, but hopefully it doesn't, but we don't know what tomorrow brings.
And what is happening with the consumers with this recall? I've been told that the injections to replace the steroid injections are upwards of $1,000. I mean, they're looking for...
We have alternatives that aren't quite that pricey. I mean, there are some other... This one thing was more of kind of a time release preparation, and they can go to things that are a little more immediate, that they maybe have to get the injection a little bit more often. So there are some other alternatives. I haven't heard anything that's sky high dollar-wise, but generally what happens in the marketplace, it's all kind of runs in a balance, and all of a sudden this provider can't provide anymore, and it causes the demand for something else, and hopefully they can keep up with that. Sometimes they can't, and then we have shortages, and then we run into that situation, and that's just kind of the market that we live in these days.
Is that a concern that you have?
Oh gosh, yeah. I have one full-time employee in the pharmacy. That's all she does is try to keep track of the ordering and the shorts and replacements and what's going to be released. We see that a product will be released in 3 weeks. She's already ordering and trying to get in a back order status, so as soon as the wholesaler gets it, boom, they're going to ship us what we need. We notify the doctors if there's a product that we can't get a hold of, so they can offer alternatives or other solutions to medications to be given. And then sometimes if there isn't, then they have to determine is this still a procedure or a course of therapy that we want to continue with or not.
But you're saying this is the largest recall that you've ever known in your life?
Tylenol was probably more widespread, and because there were a lot more products that J&J made, so that was probably bigger, but this is probably the most significant one since then, particularly with the amount of deaths that we've seen.
I know the medical profession has changed. Pharmacy, as a pharmacist and as a physician, from a standpoint of you're having patients come in and say, all right, I want this, I've seen commercials for that. Now, with the with the flu shots, you know, I know that's popular right now. There's no active, I don't know the proper wording, there's no active agent, I guess, in the shot.
It's attenuated, it's a killed
Yes.
virus.
So when people come in and, you know, whether it's shots, eye drops, you know, open heart surgery products, is there things people can do beforehand or look into that, you know, if they have these concerns, that they could ask about? Or I know that's not going to make your job or your job any easier, but ask about.
I guess my best answer, you know, we live in the world of the internet, but be careful where you go. If you go to the FDA, you go to CDC, you go to some of the governmental websites, I think you can get good information. You can find if there's been any drug recalls on a particular product, if there's any issues. I don't know if I'd go to Better Housekeeping, not that I'm against them, but I mean, you got to be careful what your source is when you get this information. But if they go to reliable sources such as the FDA and the CDC, you know, I think they get good, up to date. And it changes every day. Dr. Kaufman's like me. I think we read that site every morning and we come in to see, okay, what's changed since yesterday. So that'd be a good place to start.
So what sort of preventative measures can be taken here on the local level to avoid this in the future?
Well, we do our due diligence as far as the product that we buy. We do everything we can to buy from the reputable mainline manufacturers, the Pfizers and the Glaxos and the things that everybody's familiar with. Then as we have to step into an alternative supplier, we get as much information as we can as far as the licensure of the state, make sure that they have a license in the state of Illinois to sell the product, to look to see if there's been any drug recalls. We can go to the FDA website and check out what their history is. So we'll do our due diligence before we just, you know, start buying a product from that company, particularly if it's not one that we've ever heard of, it's fresh into the market. We belong to a purchasing group called Novation, and they have a division that helps us to look at that. They'll actually do on-site visits of the plants, and they had been in Massachusetts, and they had looked at Ameridose, kind of the sister company of NECC, to look at their manufacturing standards and processes to make sure that they were, you know, meeting standard. So, you know, we try to do everything we can. You know, we thought we had, you know, purchasing these other products that we have.